Hello everyone. So this video is about propranolol. This medicine has been being used by so many people off-label in social setting. So I wanted to create this video. Um, People are using for social moment, and this medicine is called propranolol. Inderal is a brand name. It blunts body's jitters like tachycardia, palpitation, tremors, sweating without sedation. So people feel steadier for talks and interview and weddings and first dates, etc. And celebrity influencer mentions, you know, about this product all the time. They call it beta blocker. You can easily get it through telehealth prescribing, and the demand has just surged. There's about 30% more usage in 2020. It's not a controlled substance and perceived as a safer, fast-acting alternative to benzos for one-off performance anxiety, though this treats somatic arousal, not cognitive worry. What does the data say? It's effective. Beta blockers help performance only social anxiety, like public speaking. They reduce adrenergic symptoms like tremors and nervousness and palpitation and can improve task performance. Some cases also. It is not effective for generalized and social anxiety when taken daily, but if it's combined with other medications for anxiety, then it's effective. And I've seen psychiatrists using it often. I have used it as well and quite effectively. So the guideline by NICE for social anxiety is behavioral treatment and SSRI, and beta blockers are not recommended for generalized social anxiety beyond performance type, but it is being used. Not everybody follows everything by societies or some guidelines. People use their own experience, and its use has been going up. Research from the UK show beta blocker prescribing for anxiety rose substantially from 2003 to 2018, especially in young adults, despite limited guidance. So guidance is there, but doesn't mean that you have to follow the guidance. When you're in personal experience, you're seeing something different, and there's always off-label uses of medication. What is the FDA approval on label indication for propranolol? And it's used for hypertension, angina, certain arrhythmia, post-heart attack, mortality reduction, hypertrophic subaortic stenosis, migraine prophylaxis, essential tremor, we use it often. Sometimes people who have some endocrine tumor called pheochromocytoma, or even people with hyperthyroidism, we use this medication often. And in pediatric cases, we use for proliferating infantile hemangioma. So it's a common off-label use you will see is performance anxiety, stage fright, test anxiety. Typical usage is a small dose taken 30 to 60 minutes prior, and it really helps. Portal hypertension, people with the variceal bleed prophylaxis, people with cirrhosis, we use them. As I said, hyperthyroidism or thyroid storm, for controlling symptoms, because propranolol inhibits peripheral conversion of T4 to T3 at higher doses. Then some tremors like lithium-induced tremor. Sometime even in the PTSD, some psychiatrists have been using it. I think that you got to be careful though. If you have asthma, it can cause bronchospasm and worsening of asthma. If you have a low heart rate, it can cause heart block. And if you have history of diabetes and if you develop hypoglycemia, this medication will blunt the symptoms of hypoglycemia. And you cannot use this medication with other stimulant like cocaine or other stimulant like a speed and things like that. Um, it's a non-selective beta blocker, and so it can definitely worsen asthma and mask the symptoms of hypoglycemia. So I just wanted to create this video because I read about it in Wall Street Journal today. So just for my followers. So if you have any question, you can ask. Thank you for watching.